Okay, Dr. Goodin back again with another video about the wrist and the hand joints, specifically the joint movements. Okay, let's head right into it. Okay, so here we are back in the slides for the wrist and the hand, and we're going to talk about joint movements. So the wrist joint first, this is a condyloid type joint. It allows for flexion, extension, adduction, which is going to be this way, because if we're in anatomical position, pinky comes toward the midline, and abduction. We also call this ulnar and radial deviation, but we'll talk about that later. And this motion occurs primarily between the distal radius and the proximal row of carpals. Okay, so it's going to be right in here that most of that motion at the wrist occurs, although we do have a little bit of movement at the rest of the between the rest of the wrist bones. This is called the radiocarpal joint, and we're just going to refer to it as the wrist. Now, the range of motion, we tend to have 70 to 90 degrees of wrist flexion, 65 to 85 degrees of extension, so slightly less, but very close, 15 to 25 degrees of abduction, and 25 to 40 degrees of adduction. Now each finger has 3 joints. The metacarpophalangeal, or MCP joint, so that's going to be between the metacarpal, right here, and the first phalange. And then the proximal interphalangeal joint, and that will be between that first phalange and the second phalange. And the distal interphalangeal joint, that will be between this middle phalanx and the distal phalanx. Okay, so 3 joints between the 4 different bones, here, here, and here. MCP, PIP, and DIP. Now the thumb only has 2 joints. The MCP joint, which is right here, and the IP joint, or interphalangeal, which is right here. Now, in addition to those 2 joints that the thumb has, we also have the CMC, or carpometacarpal joint. So really, does the thumb have 2 joints? Well, this third joint, I don't know, I kind of say it has 3. This third joint, the CMC joint, is the unique saddle type joint that allows for opposition and repositioning of the thumb. Okay, so we mentioned that the wrist can do flexion and extension, that's in the sagittal plane, abduction and adduction in the frontal plane. The fingers can flex and extend, but the MCP, or metacarpophalangeal joints, can also abduct and adduct. And let's look at what all of those look like. So abduction is movement not away from the midline of the body when we're talking about the fingers, but it's movement of the first and second and fourth and fifth fingers away from the third finger. So here is an example of wrist flexion and finger flexion at the same time. And we're going to see soon that you have some muscles that do perform both of these actions. And here's wrist and finger extension. Now for wrist extension, you can move past anatomical position. For finger extension, you really can't move too far past it. It's really just returning from finger flexion. And then we have abduction, also called radial flexion or radial deviation. Movement of the thumb side of the hand toward the lateral aspect or radial side of the forearm. And then we also have phalangeal abduction. Remember, that's 1 and 2 and 3, and 4 and 5 moving away from 3. And we also have wrist adduction. So now we're moving towards the little finger side, or the pinky finger, and phalangeal adduction. Now moving all of those digits back towards the third digit. And finally, we have opposition and reposition of the thumb at that CMC joint. So opposition is moving the thumb opposite of the rest of your fingers so that you can manipulate objects and grasp things and throw things and make tools and make fire and use an iPad. Reposition is putting that thumb back in position. So that wraps up joint movements for the wrist and the hand. Tune in next time to talk about the muscles that cause those movements. Hey, thanks for sticking around to the end of the video with me. If you have any comments or questions about the wrist or the hand joint movements, leave them down below and I'd love to get back to you as soon as possible. To continue learning, let's head right over to this video to talk about the muscle actions of the wrist and hand. If you missed any of the previous videos or you want to skip ahead, head over to this playlist over here, Structural Kinesiology. As always, this is Dr. Goodin, trying to make kinesiology concepts approachable, applicable, and understandable. Thanks a lot.